Ms. Spaulding has been an infection preventionist for many years and has a lot of experience. So, Linda, can you tell us a little bit about what's going on in the front lines?
Well, a lot of fear, a lot of worry, and a lot of exhaustion. Everybody across the country is busy with this COVID pandemic right now. The frustrations coming in when we can't get test kits, or we can't get PPE that we need. And we've always taught people that when you go in an isolation room, you come out, you take your PPE off and you dispose of it. Now we're telling people you have to either wear it all day, or when you come out, you have to take it off and hang it up and save it for the next time, because there may not be PPE in a week or 2 weeks. So it's bringing a lot of fear.
Right, and then basically you have to advise people to do what you've been advising them not to do all these years, right? In a way.
Exactly. It's very different for healthcare providers.
Where are you? Are you on the scene right now in the hospital or hospitals? Like we did run a picture of you in full metal jacket, so to speak, right there on the front lines.
Yeah, that was my way to try to get people to understand if they want to protect the healthcare workers, so the healthcare workers are not ill, so they could take care of them. If they come down with coronavirus, it was like, please stay at home. Social distancing is the most important thing. I'm currently in Texas working. I get, since I'm a consultant, I get many calls off and on during the week of, just questions and answers type of things. And I try to provide as much information as I can to attempt to keep people safe.
Who's calling you mostly? Is it mostly other infection preventionists or doctors or nurses? I guess
no, it's a lot of physicians. Been getting a lot of calls from them, a lot of nursing staff, and actually quite a few people in the public, because they hear on TV everybody can get tested, and so they call the hospitals to say, hey, I want to come in and get tested, when the reality of it is they can't test. The hospital I'm at, we have about 48 testing kits, and that's it. We started out with 25. So we just can't, we're trying to save those to test the people that get admitted to the hospital that are so unstable they can't go home, and the quarantine in place. And so that's what we're just triaging over the phone as much as we can to keep people at home if they don't need to be hospitalized. And of course, everybody wants to be tested.
Everybody wants to be tested. What do you see? What do you see for infection prevention as their biggest challenge right now? I guess getting through this somehow, right? But I mean, if you had to give them the advice that you are giving them, what do you tell them?
For infection preventionists, just keep your patience. We're asking people to do stuff that they've never had to do before. We have never done it ourselves as infection preventionists. So a lot of it is new to us. We have to be comfortable with the fact that we have to reuse PPE for multiple patients. But one of the things they have to remember is those multiple patients all have the same illness. So it's not like we're going to transfer a multi-drug resistant organism to the next patient, because we try not to use the same PPE for those situations. We just don't want to get to the point that we have nothing to use.
That's interesting. That's interesting. So if I guess the thinking goes now, because we're so low on PPE that if I can paraphrase what you just told me, you're telling infection preventionists and others on the front lines that as much as you don't like the idea of reusing PPE, if you do it for COVID-19 and only do it for COVID-19, it's probably a better way to go.
Exactly. And we don't know, what's going to happen when this is over. Maybe we have transmitted multi-drug resistant organisms to multiple people because of the practice, but we don't have an option.
You're a very fine writer. As I mentioned, you have something on our website right now. Are you going to write about this when you're done?
I'm thinking about it. I think there's a lot of nurses out there that are in worse situations than I've been in since it started. But I think there's a lot of questions that medical professionals need to have answers to when this is all over with. So we learn from each other from different areas of the country and maybe make better pandemic plans for each of the hospitals. Everybody should be writing about lessons learned. I have learned that there's a lot of healthcare workers that will step up and do whatever they can. I have also learned that there's a lot of healthcare workers, like the general public, they're fearful. They're afraid they're going to get it. They're afraid they're going to take it home to their families. We have some healthcare workers that the families have broken up, if not broken up literally, but living in 2 different houses now because one of them is a nurse. He or she wants to keep her family safe. We have physicians doing the same thing. Families are living in one place, the healthcare worker is living in another place, so it decreases the fear of taking it home to their families. Because we know 25 to 50% of the people out there are asymptomatic carriers. What if we become one of those asymptomatic carriers? We'll potentially give it to our coworkers and everybody we're around, and we're never going to know we're an asymptomatic carrier. If there's an ethics committee in the hospital, they can help make decisions that healthcare workers may have to make. If you have 1 ventilator left and you know the people that need the ventilator, how do you make the decision on which one you're going to intubate? You know, maybe it's 2 coworkers, maybe it's 2 doctors that are loved in the hospital, and now you have to make that horrible decision. Use your ethics committees. Try to get some kind of a, even if it's telemedicine, psychological psychiatrist or somebody that can help talk to you and make you feel better about the bad decisions you've had to make. Because some patients we're just going to have to let go, and that's going to really cause sadness and internal frustration for healthcare workers. I wouldn't be surprised if some of them have PTSD after this.
I mean, everybody says that older people are much more vulnerable to it, and people with comorbidities.
Yeah, I'm glad you brought that question up because a lot of people are saying it's the elderly. We're seeing a lot of individuals under the age of 40 in Texas. So I'd be very cautious for people to label any group more dangerous than another or more likely to get it. I think it depends on your underlying health. Yes, you have very healthy elderly that can get through it. I saw a newscast the other night about a 100-year-old lady that recovered from it. She was relatively healthy other than coronavirus. If you get young people with diabetes, with arthritis, with asthma, those are the people that are going to have a problem. I have a nephew that has asthma, and I worry so much about him because he's having a hard time getting his inhalers. So, you know, we have to try not to just think it's the elderly. It can be any age, depending on the place you are in the country. Like I said, Texas, it's mostly the younger individuals under the age of 40 so far. Florida, it's the elderly population. Well, because there's younger people in Texas and there's older people in Florida. So it's going to depend on the demographics of New York will tell us a lot about ages once they're able to publish what ages they've gone through because they've seen the most cases. They're going to teach us a lot when this is over. So as far as the hours worked, even though in the area that I'm in, we haven't had too many cases, we have a lot of people we have to watch, we have to test, we have to encourage to self-quarantine. Just because we're not able to test a lot, but we're not getting results back very fast either. So our results are coming back 7 to 10 days later. People hate to be self-quarantined. And that is the challenge to get people to understand to stay home. My hours, I get phone calls up until midnight every night and they start at 7 a.m. I get calls all day long. And even this past weekend, I turned my phone off one night because I needed to get some sleep. And I turned it on and I had missed 8 text messages and phone calls.
You see any hopeful signs out there?
Right now it's nose to the grindstone. Try to convince people, teach people to stay their distance and to stay safe. I mean, we are seeing some people acknowledging that and staying away. We're seeing a lot of people in the communities making masks at home and bringing them into the hospital for us to use. Will that give us the same protection as a surgical mask or a HEPA filter mask? No. But if we have nothing, it's better than nothing. So there has been a lot of communities that stepped up. There was a 10-year-old girl on TV last night they interviewed. She's made over 800 masks for her local hospital. My sister is making masks to send them here to Texas. She sent some to Kansas City yesterday. So, you know, the community is pitching in. Kind of reminds me of back in World War II when the women all went and started sewing things for the men that were off to war. Well, the communities are making masks for the healthcare workers. One thing that happened today, we had a healthcare worker that went to a local store looking for a pair of goggles. She was going to buy her own because we didn't have enough. And she told them why she was buying them. That store donated an entire box of goggles, which we desperately needed, and a whole box of different types of masks. Now, that tells me there's more PPE out there. It's just people don't realize we need it.
Okay, is there anything you want to add about and tell your fellow healthcare workers about how to get through this?
You know, hang in there. We're going to get to the end. I always say everything is only temporary. Okay. And I keep reminding myself that every day.
Okay. Thank you, Linda Spaulding, a member of Infection Control's Editorial Advisory Board.
You're welcome.